Okay, we just hit noon, so I would like to welcome everyone to our May MedZoom Signs and Symptoms of Stroke. Our speaker today is Megan Lux. She is our CHRISTUS Santa Rosa Ministry Stroke Coordinator. So I will pass it over to Megan to begin the presentation. We will allow for question and answers at the end of the presentation to be utilized through the chat feature. So once Megan wraps up, I'll come back on and we can take any questions that anyone may have. So thank you again for joining us today. And it's all on you, Megan.
Hi, everyone. My name is Megan Lux. I'm the Ministry Stroke Coordinator. I'm really happy that you all have been able to join us today. I have a lot of basic, hopefully easy to understand information about stroke that I want to share with y'all. And I hope that you take away some good ideas on how we can treat stroke. And the ultimate treatment for stroke, of course, is prevention. So I'm also going to talk a little bit about that. Okay, let's get started in talking about what stroke is. So stroke is, it's easy to understand as similar to a heart attack, but it's a brain attack. In this case, you're going to want to call 911 for any kind of stroke or TIA. It is a medical emergency. So ischemic stroke is the most common stroke, and this is caused by a blockage to the blood supply to the brain. About 85% of strokes are ischemic strokes. For hemorrhagic strokes, a blood vessel in the brain bursts. And so those are the other types of strokes. And then we have our TIAs. And when a person has a TIA, the blood flow to the brain is temporarily blocked. And a lot of times people call these sometimes a mini stroke or a warning stroke. And the important thing to remember about a TIA is that it will lead to it could lead to a larger stroke later, especially early in the 2 days following the TIA. You may, but even up to like 90 days, people can have a stroke, and later, of course. But the highest risk time is the 48 hours after a TIA. So if you have symptoms of a TIA, even if they go away, please seek care. It's for your protection. Stroke kills 150,000 Americans each year. It's the 5th leading cause of death. And women, it's the 4th leading cause of death in women, and more women get strokes than men, although it happens in both men and women. It's the 1st leading cause of serious long-term disability. So many patients, survivors of strokes that will experience a lot of disability, sometimes paralysis. They may have trouble controlling their movements. They may end up with stiff limbs from lack of movement. They can have pain issues, loss of bladder and bowel control, loss of ability. Sometimes they don't recognize the side of their body that's been affected by the stroke. Difficulty speaking, difficulty understanding, memory issues. Sometimes they can't focus. They have a shortened attention span. Also, sometimes the personality completely changes. I've seen patients that were very reserved that are much more outgoing, if you will, after the stroke. Just sometimes depending on the area of the brain that it affects, it can really change the person's personality. Depression, anxiety, sometimes due to the dealing with the stroke, but sometimes it's due to the area of the brain that it's affected. So what we want to look for, like I said, stroke is a medical emergency, and if you or anyone you know shows signs of stroke, please call 911. Every minute matters. Time is brain. So they may experience a sudden loss of balance, dizziness, sometimes spinning sensation that can be accompanied with nausea and vomiting. They could have a loss of vision in either eye, full or partial vision loss. If you notice that someone's face looks uneven, ask them to smile. And often with a stroke, if they're having facial, their face is being affected, you will see one side that's able to move and one side that is not. Arm or leg weakness or hanging down. So sometimes when someone has a stroke that affects one side of the body, they'll be sitting or standing and suddenly they'll either slump in their chair or they'll fall down because they're not able to move that side of the body. Slurred speech is another thing that can happen. Also, trouble speaking. They can't come up with the words. They try to speak. They look like they're trying to tell you something, but nothing comes out. Or they're not really understanding what you're saying. They seem confused. They have altered mental status. So these are some signs of stroke, classic signs, and you want to go ahead and call 911. All right, let's talk about how the best way to deal with stroke is to prevent it in the first place. So healthy habits are what prevent stroke. Diet is really important. You want to eat lots of fruits and vegetables and have a low sodium diet. This is not just for stroke, but health in general too. Maintaining a healthy weight, getting some exercise. Any type of exercise helps. Not smoking, staying away from people who smoke so you're not having secondhand smoke affect you. And then limiting or avoiding any kind of alcohol use. Also, preventing or managing other health conditions. Some of the major health conditions that can lead to stroke are high blood pressure, high cholesterol, diabetes, and obesity. So people with those conditions should definitely be going to their doctors, keeping their appointment with their doctors. I say doctors because you have a primary doctor, but then sometimes people with their health conditions also have a specialist for a particular health condition, like a cardiologist. If you've had a stroke in the past, a neurologist, and so on. Also, make sure you're taking your medications as prescribed. It's really important that if you have a daily medication or it's twice a day, that you're taking it as you're supposed to take it. So knowing, understanding how to take your medicines and going ahead and making sure you do that is really important. And then on this last slide, I put some resources. There's some really good resources on the www.stroke.org website, as well as the CDC has good stroke information, and www.heart.org also has some really good stroke resources. So I put these up there for you to view.
Okay, so we will go ahead and open it up to questions then. Thank you so much, Megan. I think that was a great overview of stroke. So if everybody takes a look at their screen at the bottom, there's a little bubble that says chat. So if you have any questions you'd like to ask Megan on stroke, the signs and symptoms, please feel free to utilize that. And then Megan, as they come in, I'll just read them off to you.
Okay.
And I know that, sometimes it takes a few minutes to type, so y'all take your time and when typing those questions, and we'll give everybody a little bit of time to get those in. Megan, do you have any information we can share with the group if they want to call or reach out to you?
Sure. So a good, I can put my my email up there, or
Okay,
my phone number.
Okay, perfect. Okay, and then I have a couple questions. So the first one, is stroke hereditary?
So stroke is not hereditary, but some of the conditions related to stroke, like like hypertension, that can be hereditary.
Okay. Then we got the next question. If you had a stroke in the past, what is the likelihood of having another one?
So I don't know the specific statistics on that, but if you have had a stroke in the past, you are more likely to have another stroke.
Okay. And then the next question is what do they do at the hospital when you go in with a stroke? I think that's a great question.
That is a great question. So the first thing they do when you go in with stroke symptoms is get you to the CT scan so they can see if you're having a stroke. What they're looking for with the CT scan is to make sure you're not bleeding in your brain. And after that, they will make sure that you get a neurologist to see you as soon as possible. So they'll call at our CHRISTUS facilities. We have a tele-neuro cart, and our neurologist is right there meeting with you. So that is what happens, and then they decide what kind of treatment you should have. They do things like making sure that you're safe to swallow. They'll test you for your swallowing. They'll do things like making sure that if you're eligible for medication to break up any kind of clot or blockage in your brain, that they offer that to you, and that they're able to do that. So that's one of those things too, that time is very important. You have to get to the hospital as soon as possible to be eligible for some of the treatments.
I'm going to ask you to expand on that. Can you do a little bit more information on the stroke blocker?
Okay, sure. So you need to make sure, ideally, we want you to be in to the hospital as soon as possible, in less than 3 hours. But the sooner you get there, the better off, because every moment that's blocked, your brain isn't getting blood supply and you can have brain damage from that. So we want you to get there as soon as possible. And the medication is an IV medication. And they do screen you to make sure that you're eligible. Some people, if they're already on a blood thinner, they wouldn't be eligible for it, for example. And then a large reason why people are not able to, the most common reason is they didn't get to the hospital soon enough. So make sure that you get there as soon as possible.
Okay. So then your next question is, does cholesterol increase stroke risk?
Yes, uncontrolled cholesterol. So if you do have high cholesterol, you want to be taking your statin medication. You want to be taking your cholesterol medication to make sure that you're not putting yourself at risk for stroke.
Okay. And then I think somebody else was trying to ask a question on the screen, and I'm not sure how you did that. You're more Zoom savvy than me. But the chat feature is down at the bottom of the screen. You've got a menu. It's got a little bubble. It says chat. If you click that, it'll allow you to type your question. So hopefully that makes it a little bit easier for whoever was trying to write. Okay, and then Megan, the next question is, how does alcohol impact stroke?
Okay, so alcohol use can, overall, it makes you more unhealthy and can lead to stroke.
Okay. Okay, so we'll still leave it open for questions if anybody else has any questions. Can kids have strokes?
Yes, yes, stroke can happen, although it's more common in adults and especially older people. Strokes can happen to anyone. So make sure that this, be increase stroke awareness, help us all out, share any information you've learned today with your family and friends. encourage them to learn about stroke and the signs and symptoms so that people can get help as soon as possible.
Okay, and I'll go ahead and add to that one as well. Are the signs and symptoms for children the same as adults?
Yes.
Okay.
Yes.
Okay, we've got, what is TIA?
So it's that mini stroke or warning stroke. It stands for transient ischemic attack. Transient meaning that it is temporary, and ischemic is a blockage, and it happens suddenly. The other thing that I don't know that I covered, and I just want to put this out there, stroke is sudden. It's not a gradual thing. It's like it happens very quickly. So it's that's one of the things about the signs too that you will notice if you see someone with a stroke. It happens quickly. They were fine and now they're not.
And then this is a question for me, and then I have another question from the audience, but is it better to, if you're having stroke symptoms, call an ambulance or drive yourself, or you kind of expand on that? I know a lot of people get scared and don't know exactly what to do. Is it best to call an ambulance?
Yes, it is, because that will increase your time to get to the hospital. They will start assessing you right away, doing a stroke screening on you, and being able to tell the hospital when you arrive what symptoms you're experiencing. They will even call the hospital from where you're at your house and say, I'm bringing this patient in, she's having a stroke. So they're all ready for you when you get there. They're prepared, because time does matter. I know a lot of people wait, they wait, well, I'm going to wait till my family gets home. Please don't do that. Please call 911 and get the ambulance to transport you.
Okay. And then the next question is, can stroke kill you?
Yes. Yes, stroke can kill you. It's the 5th leading cause of death, and the 4th leading cause of death in women. So yes, it definitely can kill you.
And I think too, that's why time is so important, right, Megan?
Yes, time is very important, because just like when someone's having a heart attack, I know some people understand heart attacks more than strokes, but it's very similar. Time does matter, and you need to get to the hospital.
Okay, so then your next question is, does saturated fat in food impact stroke risk?
Yes, so fats can impact stroke risk, and having a healthy diet is very important. Like we talked about, low sodium, lots of vegetables, low fats is also good. But some, there are healthy fats as well. So, but saturated fat is, limiting saturated fat is a good option for your healthy diet.
Okay. So I'm going to leave it open for questions for about 5 more minutes. If anybody wants to get any more questions in. And then also, just so everybody knows, we're having another Med Zoom tomorrow, was also advertised on our Facebook, and that's going to be screening for strokes. So if you would like more information on screening for strokes, we have Dr. Risby speaking tomorrow on another Med Zoom. Okay. Okay, Megan, the question is, do you mean like a Mediterranean diet?
Yeah, Mediterranean diet is a great example of a healthy diet that would help prevent heart disease, stroke. It's definitely a good option.
Erica, you can check out our Facebook, CHRISTUS Santa Rosa Health System, or let me put my email in the chat box, and you can send me an email and I can send you the link directly. We do 3 Med Zooms every month. So if you want to get on that mailing list to receive all the information, I can definitely get you signed up. So I am putting my email. My name is Megan as well. I know that's kind of confusing. I'm putting my email in the chat box so I can get you put on that mailing list to get the MedZoom notifications. We try to do 3 different topics every month. Since this is stroke month, we're a little more stroke featured, but we do 3 of these presentations a month. So I'll leave it open again just for a few more minutes if there's any questions, any more questions.
Megan, would you mind putting my email in the chat box as well so they can contact me with any further questions, concerns, or anything you have want to know about stroke? I can get you those answers.
Absolutely. So I am your host. I am Megan Sparks. So if you want information on other MedZooms, email me. Megan Lux is our stroke coordinator. So if you have any questions on stroke, email her. She's with a H, I'm without. Thank you, Joan. We appreciate everyone being here. We hope that getting this word out saves lives. And again, Megan, thank you so much for your time. I think it was great information. Thank you to the audience for your great questions and interaction. We appreciate it. I'm going to leave it open for about 3 more minutes. If anybody has any questions, go ahead and get them in. If not, please feel free to reach out to me or Megan. And if you're enjoying these and you find them helpful and you saw us on Facebook, like and share so other people can join as well.
Yeah, get your friends and family to come join as well.
Yeah. Yeah, that is a very good idea. We used to do a lot more community presentations, and then COVID kind of put a nix on that. So hopefully with more vaccines and COVID numbers, hopefully staying on the decline, we'll be able to get out in the public again and do more face-to-face. But Zoom made it possible for us to do this while we're still dealing with the new COVID life. Okay, so you have a question. Does lipitor help?
Yes. So lipitor is a statin, and it is one of the statins that prevent. Statins are the best cholesterol medicine for preventing stroke. And when people have a stroke, they one of the things that we do is we give them high dose statins to prevent another stroke. So that's one of the treatments that's given to patients after having stroke. There are a few individuals that are intolerant of statins, and then they have to use something else, but the statin is the best cholesterol reducing medication for stroke. And then antihypertensives are really important as well. I just want to add that if you do have high blood pressure, it's really important that you take your antihypertensives to prevent strokes. I have personally taken care of patients in the hospital that had a stroke because they didn't refill their medication. And it's just so sad because it's such an easy thing to do to prevent a stroke. And then if, when you do have a stroke, sometimes you don't regain your full abilities. And it could have just been prevented by taking that medication. So medications are very important to your health when you have hypertension and hyperlipidemia or high cholesterol.
And Megan, they said, thank you for your info. You are so smart.
Oh, thank you.
Okay, we got another question. Can you drive after stroke?
Hopefully, you can if you do not have long-term disabling things that have happened, like for example, with movement paralysis, you may not be able to drive again. Hopefully that wouldn't be the case. But getting, like I said, getting to the hospital as soon as possible is what's going to prevent you from having those disabling conditions. And that clot busting medication can really prevent those disabling conditions. So, and the only way you can get that is by getting to the hospital early.
Okay, then we got, what herbs can help prevent stroke? Can garlic?
So there aren't really any herbs that can prevent stroke. I encourage that if you are interested in using medications and herbs, supplements, that you share that with your doctor, so that a lot of the supplements are not regulated like drugs are, and you can end up having issues with some of your chronic conditions if you have something that's not the right amount of supplement. So for example, I knew a patient that was taking medication with supplements with high vitamin K levels, which was increasing their clotting mechanism in their body. So it was, and they did have a stroke. We don't know if that contributed to the stroke, but if you're taking any supplements, if you're taking anything other than what your doctor's prescribed, or you want to, make sure you run that by your doctor and make sure that that's safe for you and that it's an appropriate thing to be doing.
Okay, I'm gonna leave, oh, sorry, we got another one. There we go. I love the questions. Keep them coming. Is dairy saturated?
So it depends on the dairy, because there's low fat versions and then there's full fat versions. And I think everything in moderation is okay, unless your doctor tells you that you're not allowed to have certain things. You can have a little bit of full fat stuff, just not, I would also have some low fat, dairy in there, just kind of to balance things out.
I appreciate all the questions because it kind of helps give me an idea for future topics. And I think that nutrition might be a good future topic to have. So
I agree.
do probiotics help prevent?
No, probiotics will not help prevent, but they do help contribute to your health. Also prebiotics, which is, your fibers and things like that. There lots of fruits and vegetables. All of that stuff is good for your body. But no, those will not prevent you from having a stroke. It's kind of a combination of things. You got to have a healthy diet. You have to exercise. You have to go to the doctor. You have to do all these healthy habits, and all of those things together. And if you have chronic conditions, taking medications, all of those things together are what keep you from having a stroke. Nothing's easy, right?
Okay, so again, thank you so much for your time today, Megan. Thank you for everyone that joined us. Again, I'm going to close out the questions, but I'm going to leave the chat box open for a few more minutes if anybody wants to grab our emails. And we hope that you will join us again soon. Thank you.
Thank you so much.